Hi, my name is Mary Delgado. It is August 24th, 2022, and I will be performing my head-to-toe assessment on Miss Rachel Humphreys. I've already obtained consent from her. I'm gonna scan the room, the walls. That's our stand for filming purposes, the ceiling, the floor, it's our table, and the Snell and eye chart. And now I'll begin. As I enter the room, I've washed my hands, I've introduced myself. First, I will inspect her skin on her head, neck, anterior chest, posterior chest, and abdomen. I'm looking at the color, texture, temperature, turgor, moisture, looking for any lesions, nevi, scarring, bruising, or any deformities. I am going to, also looking at the moisture, I'm going to next inspect her head for size, symmetry, and midline position. I'm going to begin inspecting and palpating her head. I'm looking at her hair distribution, texture, and temperature. Her head, I am feeling for any tenderness, depressions, looking for infestations, feeling for any masses, lesions, or any tenderness. Next, I'm going to palpate her her temporal arteries for tenderness. No tenderness, good. I'm going to assess her lymph nodes with the preauricular, postauricular, occipital, tonsillary, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Next, I'm going to assess cranial nerve 5, which is the trigeminal nerve. I'm going to feel for her masseter muscles. Can you clench your jaw? The motor of it is bilateral and symmetric. I'm going to, if you'll close your eyes, tell me when you can feel this touch, testing symmetry of cranial nerve 5. You feel it?
Yes.
Where do you feel it?
Cheek, chin, cheek, forehead.
Good. Next, I'm going to assess cranial nerve 7, which is the facial nerve. Can you smile, frown, raise your eyebrows, blow out your cheeks, puck your lips? Facial expressions are symmetric. And I'm going to feel her TMJ, open and close, feeling for any signs of subluxation, tenderness, or crepitus. Next, I'm going to assess her ears. Her ears are midline. The color is normal. There's no signs of lesions, masses. Is there any tenderness in the pinea or the tragus?
No.
I will look inside her auditory canals with my otoscope, pulling up on her ear. I'm looking for patency, looking at the tympanic membrane for any swelling or redness. I would do that both sides. Next, I will assess cranial nerve 8, the vestibulocochlear nerve, which is her hearing. I will perform the whisper test. So if you will, close your right ear and tell me what I'm whispering.
1, 2, 3.
And the left ear, A,
ABC.
Whisper test is normal. Next, I'm going to test lateralization of her hearing. Can you hear the vibrations midline, normal, or on one side greater than the other?
Midline.
Weber test for hearing lateralization is normal. Next, we'll perform the Rhine test by testing air conduction and bone conduction. Is it louder, is vibrations louder in position A or position B?
A.
Good. A or B?
A.
Good. Air conduction is greater than bone conduction in both ears bilaterally. Next, I'm going to look at her eyes. I'm assessing her eyebrows and her eyelashes, as well as assessing for palpable fissures. I'm going to look at her sclera and conjunctiva, looking at the color of her sclera, and conjunctiva, looking for any lesions or any discharge. I'm going to, if you'll just look at my right ear, I'm assessing her internal structures of her eye. I'm going to look in both eyes. If you look at my left ear, I'm looking in your left eye. Good. Next, I'm going to assess cranial nerve 3, the ocular motor nerve, by testing direct and consensual pupillary restriction to light. The lights would be down for both of these tests so far. So, pupils directly and consensually constrict with light. Cranial nerve 3 is intact. Next, I'm going to assess for accommodation and convergence. If you could follow this object, good, and back. Eyes accommodate and converge appropriately. Next, I'm going to assess her extraocular motor of her eyes. By assessing cranial nerve 3, the ocular motor, 4, her trigeminal, and 6, the abducens nerves, by assessing her vision in the cranial fields of gaze. So if you'll just follow this, now follow the object. Good. Extraocular motors intact. Now with the lights back on, I'm going to have you step over and perform visual acuity with the Snellen test. Now if you'll cover your right eye. That's your left eye. Your right eye. Now read this lowest line.
D-E-F-P-O-T-E-C.
Good. Now cover your left eye.
D-E-F-P-O-T-E-C.
Both eyes open.
D-E-F-P-O-T-E-C.
Good. Visual acuity is 20/20, which assesses ocular motor nerve 2, which is the cranial nerve 2, optic nerve. Next, I'm going to assess the position and for any deformities of her nose. Her nose is midline, and there's no signs of deformities. Now I'm going to assess for patency, blowout. It is patent bilateral on both sides. If you could close your eyes, what do you smell?
Alcohol.
Good. The cranial nerve 1, her olfactory nerve, is intact. Next, I'm going to look at her mouth. I'm assessing mouth and throat, her lips first, now her teeth, her gums, if you open up wide, her buccal membrane, I'm looking at her tongue, I'm looking at the palate, I'm looking under her tongue, I'm looking at the salivary glands, as well as her uvula, and her tonsils. She has tonsils, they are 2+. Now if you can keep your mouth open and say ah. Uvula and soft palate rise and fall with pronation, which is cranial nerves 9 and 10. The glossopharyngeal and vagus nerves are intact. Now if you will stick out your tongue, now tongue is midline, now go side to side. Tongue is midline, move side to side with no fasciculations. Cranial nerve 12, the hypoglossal nerve is intact. Next, I'm going to inspect and palpate her trachea. It's midline. I am going to palpate her thyroid gland. Just if you could swallow. Good. Thyroid gland is normal. I'm going to palpate her carotid arteries. They are 2+ bilaterally. As she holds her breath, and with my bell, I'm going to listen for bruise. Good. And next, I'm going to start performing my posterior chest assessment. So as she flips around, I'm first looking for symmetry and any signs of deformities, as well as any signs of respiratory distress would be indicated by use of accessory muscles, tripod breathing, nasal flaring, retractions, tachypnea, cyanosis, And I'm going to feel for chest expansion, deep breath. Good. I'm going to palpate for tactile firmitus, say 99.
99, 99, 99.
Good. I'm going to percuss in the intercostal spaces. The lower lung beds as well as the lateral bases. I'm going to now listen or auscultate all of her lung fields beginning above the scapula and between the intercostal spaces. Just deep breaths. Lower lung beds as well as lateral bases. Next, I'm going to perform egophony. So if you can just continue to repeat 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Good.
99.
Now bronchophomy. Continue to repeat. That was bronchophomy. Next is egophony. Continue to repeat E.
E, 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 E.
And whisper pectorally. If you could whisper 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Good. Now if you'll flip forward, I'm going to inspect for symmetry and any signs of deformity of the anterior chest. I'm going to feel for chest expansion. It is symmetric. I'm going to palpate for tactile firmitus, say 99.
99, 99, 99.
Good. And then I'm going to also take in between intercostal spaces in all of the lung fields. Deep breaths. Good. No adventitious lung sounds. Next, I'm going to begin performing my cardiac assessment. I'm going to auscultate with the bell as well as the diaphragm all 5 of the cardiac valves, beginning with the aortic valve, which is at the right sternal border of the second intercostal space. The pulmonic is at the left sternal border at the second intercostal space. Erb's point is at the third intercostal space in the left sternal border. Tricuspid is the fourth intercostal space at the left sternal border. And mitral is the midclavicular line, thank you, and the left sternal border, the fifth intercostal space. I listen with my bell. Now I will listen with my diaphragm with the aortic, pulmonic, Erb's, tricuspid, mitral. I'm going to palpate the point of maximal intensity. I am also going to auscultate for 1 full minute her apical pulse. Her heart rate is 66, regular and rhythmic. Next, I'm going to have her lay down. As she's laying down at the 30 to 45 degree angle, I'm going to assess for JVD, pulsation, or distension, and then I'm going to have her lay completely flat. As she's flat, I'm going to inspect for any heaves or thrills. There don't see any. I'm going to palpate for any thrills at all 5 valves. I inspected for heaves and lifts. I'm palpating for thrills. Good. Next, I'm going to auscultate again with both my diaphragm and my bell. Aortic, pulmonic, Erb's, tricuspid, mitral, and with the bell, aortic, pulmonic, Erb's, tricuspid, and mitral. Next, I'm going to auscultate with the bell her aortic arteries. If you can hold your breath. Renal, iliac arteries, renal arteries, and then femoral arteries. Next, with the diaphragm, I'm gonna, after assessing the symmetry and contour of her abdomen, I'm going to listen to her bowel sounds in her right lower quadrant, right upper, left lower. I'm gonna percuss her abdomen for tympany, dullness, next I'm going to palpate, light palpating her abdomen in the right lower, right upper, left lower. Next I am going to deep palpate for any tenderness or masses. Any tenderness, no masses felt on palpation. Next I'm going to try to palpate her abdomen from her mid-axillary line at the bottom of her rib cage. I'm going to palpate up towards her right upper quadrant. Her liver is unpalpable on her right side. And using the C cupping, I'm going to try to palpate her spleen on her left side. It is unpalpable. If you could sit up and face the back, I'm going to assess for CVA tenderness. Let me know if this is tender.
No. No.
Good. Now if you'll flip forward, we'll begin our musculoskeletal assessment. First, I'm going to, thank you, inspect her fingers, wrists, elbows, and her shoulder joints. I'm looking for any signs of deformity, crepitus, redness, swelling. I'm looking at the symmetry, looking for lesions, nodules. Everything looks symmetric and normal. I'm feeling her radial pulses, as well as checking the capillary refill of her fingers bilaterally, less than 3 seconds. Next, I'm going to do the range of motion of your fingers. So if you'll follow my lead, we're going to flex your fingers down, extend them up, hyperextend them back, abduct them out, adduct them in, and next the wrist, we're going to flex your wrist down, extend them up, hyperextend them back, ulnar deviate in, radial deviation in, ulnar deviation out. We are going to rotate your wrists. Now the range of motion of your elbows, flex your elbows, extend, hyperextend your elbows, good. And next to your shoulders, so we're gonna flex your shoulders up, extend your arms back for your shoulders, yes. We're going to adduct, abduct. We're gonna go external rotation, internal rotation, good. And we're gonna circumduction of your arms, or your shoulders. Shoulder range of motion is normal. Next, we are going to assess grip strength. So if you could squeeze my fingers, grip strength 5 out of 5. Assessing her triceps and her bicep strength, so push against resistance, good. Tricep bicep strength 5 out of 5. Next, if you could abduct your arms, good, your shoulders, and adduct, shoulder strength 5 out of 5. We're gonna assess cranial nerve 11, which is the accessory nerve. If you could shrug against my resistance, good. Cranial nerve 11, the accessory nerve is intact. Next, we are gonna test cerebral coordination. So if you can do rapid hand movements, we're gonna do hand flip-flop, good. Finger opposition, as well as this is also assessing serial finger opposition for finger range of motion. Next, we are going to do, if you touch your finger to your nose, now touch it to my finger, good. Good, now the other hand, good. Finger to nose is appropriate. I'm assessing her upper and her lower extremity. I'm feeling the skin for the warmth, the turgor, and assessing for any signs of edema, as well as the color of her upper and her lower extremities. I'm going to begin the stereognosis test. So if you could close your eyes and put out your hands. Thank you. Can you identify this object?
Coin.
Good. And this object?
Paperclip.
Stereognosis test is appropriate. Next, I'm going to assess graphesthesia. Identify this letter.
A.
Number.
3.
Good. Graphesthesia test appropriate. If you can open, actually you can keep your eyes closed. And I'm going to assess light touch in both upper and lower extremities. Tell me when you can feel this.
Yes. 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 Yes.
Light touch is appropriate. Next, I'm going to assess vibratory sensation. You can open your eyes at the ulnar prominences. So if you can tell me when you can feel the vibrations.
Yes. Yes.
And your medial malleosus?
Yes.
Good, appropriate. Next, I'm gonna assess her deep tendon reflexes. I'm only gonna do this on one side to save time. So first, the brachioradialis. Good. Bicep. Tricep. Patellar. Oh, Achilles. And then her Babinski reflex. And I would do that both sides bilaterally. Next, I'm going to move on to her lower extremities. I am looking at her toes, her ankles, her knees, and her hips. At this point, I'm going to look at her joints for the redness, swelling, deformity, nodules, crepitus, lesions, symmetry, and I'm feeling all of them. Everything feels normal. I am going to check her capillary refill in both of her feet and her toes. It's less than 3 seconds. I'm testing her dorsalis pedis pulses and her posterior tibial pulses. Next, we're going to assess the range of motion of her toes. So if you could flex your toes down, extend them, hyperextend them, good. Abduct and spread, adduct and squeeze them together, good. Now the range of motion of her ankles. If you could dorsiflex down, plantar flex up, invert, evert, good. Rotation of your ankles, beautiful. Next, I'm going to move on to her strength of her ankles. So if you can plantar flex against my resistance, dorsiflex down, good. Ankle strength, 5 out of 5. We're going to test knee strength. So if you extend against resistance, flex against resistance, knee strength, 5 out of 5. Hip strength, abduct against resistance, adduct, knee or hip, knee, ankle, strength is all 5 out of 5. Next, I'm going to have you stand up. We're going to assess your knee range of motion. So we are going to flex, extend, hyperextend your knee, good. Now your hip, so we're going to flex, extend, hyperextend your hip. You're going to abduct, adduct, internal rotation, external rotation, circumduction, and I would do that for the knee and the hip on both sides. Next, I'm going to have her turn around. I'm assessing her spine, looking for any signs of deformities. As she flexes forward, I'm feeling the curvature and the alignment of her spine for any signs of scoliosis. At this point, she is lumbar flexing. Stand up. She's extending, lean back, hyperextending her lumbar spine. Now you're going to laterally rotate, side to side, good, and twist. Lumbar rotation in range of motion, lumbar spine range of motion is intact. Next, her cervical spine, we are going to nod forward, flex forward, extend, hyperextend back, lateral rotate side to side, and you're going to rotate. Next, we are going to assess your, do a Romberg test. So if you'll stand over there and look at me, put your arms forward, close your eyes. Good, no swing, Romberg test is intact, eyes open. If you'll walk towards me 5 steps, her gait is symmetric and turn around. Now walk back, heel to toe. Gait is tandem and symmetric. Next, I'm gonna have her hop on one foot, hop on the other foot. Gait, balance, and coordination are intact. And that is the completion of my assessment.